Spinal muscular atrophy. Etiology. Progressive degeneration of anterior horn cells is the key manifestation of spinal muscular atrophy, SMA, a genetic disease with signs and symptoms that may begin in intrauterine life or any time thereafter. About 55% of patients have a severe infantile form, SMA type 1, Wernicke-Hoffmann disease. 30% have a late infantile and more slowly progressive form, SMA type 2, Kugelberg-Wellender syndrome, and 20% have a more chronic juvenile form, SMA type 3. SMA is one of the most frequent autosomal recessive diseases, with a carrier frequency of 1 in 50. Clinical manifestations. The earlier in life the signs develop, the more severe the progression. Infants with SMA type 1 present in early infancy with severe hypotonia, generalized weakness, and facial involvement. Infants have normal cognitive, social, and language skills and sensation. Fasciculations are best identified by inspecting the tongue when the child is asleep. Deep tendon reflexes are absent. With disease progression, breathing patterns change. Weak intercostal muscles and a relatively stronger diaphragm result in a collapsed chest wall, bell-shaped chest, and prominent abdominal movements with rapid, shallow breathing. In an extremely weak child, respiratory compromise leads to atelectasis, pulmonary infection, and death. Without treatment, most infants with SMA type 1 die within the first 2 years. New therapies have altered the natural history of this disease.
Laboratory and diagnostic studies. The diagnosis of SMA is made by genetic testing. Creatine phosphokinase, CK, may be normal or mildly elevated. Although not currently used to diagnose SMA, muscle biopsy specimens show grouped atrophy, and electromyography shows fasciculations, fibrillations, and denervation. SMA was added to the recommended uniform screening panel in 2018 and is now part of newborn screening in many states and being added in others. Treatment. Recently, disease-modifying therapies have become available. Nusinersen, an antisense oligonucleotide given by intermittent intrathecal injections. Onasemnogene aberavec, a gene therapy administered as a one-time intravenous infusion, and risdiplam, a small molecule given as a daily oral medication. Clinical trials have shown motor benefits, though the long-term impacts are still under investigation. Preventative care is directed toward minimizing contractures, preventing scoliosis, optimizing nutrition, and avoiding infections. Many patients benefit from early use of non-invasive ventilation to reduce infections. Respiratory infections are managed early and aggressively with preventative pulmonary hygiene and antibiotics. The use or non-use of artificial ventilation and tube feedings must be individualized for each patient in each stage of the illness.